Vaginal and cervical concerns. The cervical mucus is thin and watery and can be easily penetrated by spermatozoa for a period of 12 to 72 hours. So, ibig sabihin nito, fertile ang isang babae kasi thin and watery ang cervical mucus niya and may possibility na mabuntis ang isang babae. If coitus is not synchronized with this time, the cervical mucus may be too thick to allow to penetrate the cervix. Infection or inflammation of the cervix or the erosion can also cause cervical mucus to thicken so much that spermatozoa cannot penetrate it easily to survive in it. A stenotic cervical os or opening. Cervical stenosis is narrowing of the passageway through the cervix or the lower part of the uterus. Cervical stenosis often causes no symptoms. Rarely, the uterus fills with blood or pus. The opening of the cervix can be widened to relieve symptoms. Dilatation and curettage is a procedure to scrape and remove tissue from the inner lining of the uterus. Sperm agglutination means that motile spermatozoa stick to each other, head to head, midpiece to midpiece, tail to tail, or mix.
Testing and therapy for vaginal and cervical concern. If sperm do not appear to survive in cervical secretions because secretions are too scant or tenacious, a woman may be prescribed low-dose estrogen therapy to increase mucus production during 5 days to 10 of her cycle, which came in cream, tablet, or ring form, minimize the amount of estrogen absorbed by the body. Vaginal infections such as trichomoniasis, moniliasis tend to recur, requiring close supervision and follow-up. Trichomoniasis is a common sexually transmitted infection caused by a parasite. Caution women who are prescribed metronidazole for trichomonas infection. It may be teratogenic early in pregnancy and therefore should not be continued if the woman suspects she has become pregnant.
Unexplained subfertility. It is usually diagnosed if a couple fails to conceive after 1 year of regular unprotected sexual intercourse. Subfertility, it is the time you are not being able to conceive, but no, it's not permanent. You will be able to conceive after some time.
Assisted reproductive techniques. If ovulation, sperm production, or sperm mobility problem cannot be corrected, this is the next step for a couple to consider before beginning any of this procedure. Ang babae ay dapat umiwas sa paninigarilyo at paggamit ng droga. Dapat din siyang kumain ng mga pagkain na high in protein at dapat siyang magkaroon ng BMI na normal. At kailangan niyang magpasuri ng HIV test at hepatitis C kasi ito ang mga kasama sa follicle stimulating hormone at luteinizing hormone, estrogen at progesterone para masuri ang reserbang ovarian. Whether a woman feels comfortable choosing assisted reproduction is strongly social-culturally related to a couple. Ang mag-asawa na limitado ang budget at walang health insurance ay hindi nakaka-afford ng mga theraping ito. O labag sa kanilang relihiyon, kultura ay hindi nagtatanggap ng ganitong proseso.
Alternative insemination. Alternative or intrauterine insemination is the instillation of sperm from masturbatory sample into the female reproductive tract by means of a cannula to aid conception at the time of ovulation. The sperm can either be instilled into the cervix or directly into the uterus at the time of predicted ovulation. BBT charting, mucus analysis, or urinary test kits for LH can be used to detect the day of ovulation. Either the male partner sperm or donor sperm can be used. These procedures are used if the man has none or inadequate sperm count, or if a woman has a vaginal or cervical factor that interferes with sperm motility. Donor insemination can be used if a man has a non-genetic disorder he does not want to transmit to their children, or if a woman has no male partner. It is also a useful procedure for men who underwent a vasectomy, but not to have wish to have children. In the past, men who underwent chemotherapy or radiation for testicular cancer had to accept being child-free afterward because they are no longer able to produce sperm. Today, sperm can be cryopreserved in a sperm bank before radiation or chemotherapy and then used for alternative insemination afterward. One disadvantage of using cryopreserved sperm is it tends to have slower motility than unfrozen specimens. Using a device similar to a cervical cap or diaphragm or sperm are injected directly into the uterus using a flexible catheter. Conception through alternative insemination takes an average of 6 months to achieve, and some couples may have religious or ethical beliefs that prohibit the use of sperm from either male partner or a donor. It may not be right for every couple. It can be a discouraging process for a couple to have waited 6 months to see results. Couples may need support to continue the technique.
In vitro fertilization is a complex series of procedures used to help with fertility or prevent genetic problems and assist with the conception of a child. One full cycle of in vitro fertilization takes about 3 weeks. Sometimes these steps are split into different parts and the process can take longer.
Making a baby isn't always easy. Fortunately, there are many ways to parenthood. In vitro fertilization, or IVF, brings the miracle of conception into a laboratory. It has led to the birth of nearly 10 million babies since the first successful fertilization procedure in 1978. So how does it work? Let's take a closer, step-by-step look at the process. Step 1. Preparation. The IVF treatment process begins long before any egg removal and fertilization takes place. You'll need a thorough medical history before treatment begins, plus fertility tests and analysis for you and your partner. As the procedure gets closer, you may be prescribed birth control pills or estrogen to control the timing of your menstrual cycle and maximize the number of mature eggs available for retrieval. Step 2. Ovarian stimulation. During a typical ovarian cycle, only one egg becomes mature enough to ovulate. IVF treatment uses injectable hormone medication to bring a group of eggs to maturity to increase the odds of a successful pregnancy. The type, dosage, and frequency of the medication will be tailored specifically to you for optimal results. Monitoring of the eggs may occur daily or every few days during this time to determine when they mature. A final trigger shot is given exactly 36 hours before the scheduled egg retrieval to finalize the maturation process. Step 3. Egg retrieval. Once the eggs are mature, it's time for egg retrieval. During this step, a suction device connected to a long, thin needle is inserted through your vagina. This will puncture ovarian follicles and pull the mature eggs out. Removed eggs are placed in a petri dish containing a special solution and then placed in an incubator for a short period of time. Since this procedure is mildly invasive, medication and sedation are used. Step 4. Fertilization. Fertilization of the eggs takes place within a day during a procedure known as an intracytoplasmic sperm injection, or ISCI. A single sperm is introduced into each mature egg. On average, about 70% of mature eggs will successfully fertilize. Step 5. Embryo development. Now comes the growing and waiting. Fertilized eggs are monitored and left to develop over the next several days, with cells actively dividing. About half of fertilized embryos will progress to the blastocyst stage when they are suitable for transfer into a uterus. Embryos that are suitable for transfer can either be used right away or frozen for future transfer. Step 6. Embryo transfer. Within a week after fertilization, it's time to transfer the embryos. This is a short procedure that only takes about 10 minutes and feels very similar to a pelvic exam or a pap smear. A speculum is placed within the vagina, and a thin catheter is inserted through the cervix into the uterus. An embryo or embryos are then injected through the catheter into the uterus. After an embryo transfer, you may experience symptoms such as mild bloating and cramping, breast tenderness from high estrogen levels, spotting, and constipation. Step 7. Pregnancy. Within 14 days after the embryo transfer, a blood test will be done to determine if you're pregnant. If the pregnancy test is positive, you begin the journey of prenatal care. Pregnancy success rates per embryo transfer vary depending on the age of the woman at the time of egg retrieval. If the pregnancy test is negative, you can try another embryo transfer if you have additional embryos frozen from the first IVF cycle. If you do not have remaining embryos, you can try IVF again. IVF has been used successfully for more than 4 decades. Talk openly with your healthcare provider about your options.